Hello everyone. In this video you will learn about final or secondary impression of edentulous arch. What is secondary impression? The impression that represents the completion of the registration of surface or object or the negative likeness made for the purpose of fabricating a process called secondary impression. It is always made in bottom molded custom tray. Preparing the tray for final impression. First we remove the wax spacer from the bottom molded custom tray. Make a hole, reduce the peripheral border approximately 0.5 mm. Protecting the mouth with petroleum jelly, especially we use record impression with zinc oxide eugenol. Rinse the patient's mouth with the astringent mouthwash, especially those patients who have thick mucinous saliva. So this is a bottom molded maxillary custom tray in which we have removed the wax spacer and making holes just to relieve the impression and reduce the border all around. We should not adjust the post-palatal seal area. Why? Because it slightly displaces the soft tissues at the distal end of the denture to enhance the post-palatal seal and improve the retention. Serve as a guide for position the tray in the patient's mouth while record secondary impression. The material of choice for secondary impressions are metallic oxide impression paste, zinc oxide eugenol or eugenol-free impression paste. We can also use a medium body elastomeric impression material for secondary impression. Zinc oxide eugenol impression paste is available in two pastes. One tube which contain the base and other contain the catalyst. So this white in color is the base and this blue is the catalyst. And is used for the final impression of edentulous with minor or no undercuts. And also can be used as a wash impression with other impression materials such as impression compound. If the patient is allergic to the eugenol, he or she may have burning or tingling sensation. For such a patient, we use a non-eugenol paste containing carboxylic acid in place of eugenol. To squeeze the equal amount of the white as well as the blue color of the paste on the mixing pad. Then start mixing with a spatula as per the manufacturer instruction. And you have to mix this material until you get homogeneous color of the mixing. And then start the loading the tray with the help of the spatula and make sure it should cover evenly. All the surface are covered including the border. And then we insert the tray into the patient's mouth. First we retract the lip and rotationally insert the tray into the patient's mouth. And then hold the tray and ask the patient to perform tongue movements such as protrusion, lateral movement of the tongue. Ask the patient to raise the tongue, touch the palate. You have to perform the lip as well as the cheek movement such as downward, outward, upward, inward movement. Hold the tray till the material set. So again we have to follow the manufacturer instructions. Setting time of this material is 3 to 5 minutes. We have to check thoroughly with the material set, then we take it out from the patient's mouth and then immediately inspect the recorded impression. And you can see the fine detail record of the impression. All the borders you can see is properly recorded impression. Here is the show through of the green stick which indicate the excessive pressure at this area. This requires the relief. At this stage you can relieve at the time of insertion of the denture by application of pressure indicating paste. Same as for that with the maxillary impression. First we have to load the tray, insert the tray into the patient's mouth, hold with one finger and then perform the lip movement as well as the cheek movement. Once the material is set, then we take it out from the patient's mouth. So here we record the post-gem area. So further we have to mark the vibrating line that can be marked with an indelible pencil. I ask the patient to say a series of R sound in an unexaggerated manner. First we have to dry the mucosa with the help of the gauze and then ask the patient to pronounce the R sound and observe the imaginary line. You can see the dotted line is an imaginary line at the beginning of motion of soft palate when the patient pronounces the R sound. The similar notch can be palpated with the help of the mouth mirror or T-shaped burnishes. And we mark this the vibrating line with the help of the indelible pencils from the one side of the hemimeter notch across the palate to the another side of the hemimeter notch. And and then we reinsert the impression of the patient's mouth. This marking will transfer, you can see here, into the fitting surface of the impression, and this after pouring, this will transfer to the master cast, and this will help in extension of the maxillary denture, and the denture should be extended to the vibrating line. So this final impression is properly recorded. You can see the final record of the yoga area and this palatal area. There is no any bubbles or show through of any acrylic fitting surface. Here the borders are properly recorded. Here there is a show through of the green stick that requires relief. Medium body elastomeric impression materials that can be used as secondary impression of those patients who have undercut underage or dryness of the mouth. This elastomeric impression material required to apply adhesive on the tray for the retention of the impression material. Failure to apply the adhesive may lead to the separation of the impression material from the tray. First, we have to pour a small amount of the adhesive into the impression tray, and then with the help of the disposable brush, we spread the adhesive to apply all the internal surface of the tray, including this peripheral border as well as 5 mm behind an external surface of the tray. Same as for the mandibular tray, and then we have to wait till this adhesive become dry. We have to follow the manufacturer instruction. Failure to follow the manufacturer instructions will lead to the separation of the impression material from the tray. Polyvinyl siloxane impression material can be mixed by either manual mix or hand mix technique or auto mix technique. So it is available in the different viscosity, medium, light body, medium body, heavy or putty consistency. For second impression, we use a medium viscosity of the material. It is available in the tubes or it's available in the cartridge along with them with this mixing tip. So first we have to squeeze a small amount of the impression material on the mixing pad before loading the tray. Then we spray the equal length of polyvinyl siloxane on the mixing pad and start mixing manually with the help of the spatula. We have to follow the manufacturer instructions of the mixing until we get a homogeneous mix of the material. Then we load the impression tray with the help of the spatula. Make sure this impression is evenly loaded in the tray and cover the border of the tray as well as. Then we insert the tray into the patient's mouth and ask the patient to perform the tongue movement. You have to perform the lip as well as the cheek movement. And until the material is set, we have to take it out from the patient's mouth and immediately inspect the impression. Here you can see the show through of the spot underlying the tray as well as the periphery. So this requires the reliever remaking of the impression. So this recorded impression should be a bubble free, narrow border, and there is no show through of the green stick or underlying tray, and there is a fine detail record of the tissues. Make sure it should be an even thickness of the material throughout. Auto mixing technique. This impression material is available in pre-packaged cartridge. With this mixing disposable tip is attached to this cartridge. So this cartridge has two tubes, one contains the base, another is catalyst. So mixing tip is attached to the cartridge, which is inserted into the gun. The base and catalyst are extruded into the mixing tip, and with mixing occur as they progress to the end of the tube. Squeeze the impression material into the tray from one side to the another side, and make sure it cover the evenly on the tray, including the border as well as same as for the mandibular tray. Then we insert the tray into the patient's mouth. First we retract the lip and rotationally insert the tray into the patient's mouth. Make sure the tray should be centered on the arch and stabilize the tray with one finger and perform the lip movement as well as the cheek movement, such as upward, outward, downward, and inward movement, and same as that movement as we have performed during the periphery. To hold the impression tray until this material becomes set, and then we take it out from the patient and immediately inspect the impression. And there you can see the fine detail record of the impression. There is no any show through of the underlying tray or on the border of the this impression. Cranium is properly recorded here. So there is an excessive flow of the impression material behind the post-dem area. So this material is required to trim With the help of the scalpel, you can see this excessive material has been trimmed here, and this post-dam area is painted with the adhesive until the adhesive become dry. And then we add a small amount of the high viscosity of the elastomer impression material, then reinsert the tray into the patient mouth and record the functional of physiological post-palatal seal. Reinsert the impression in the mouth and repeat the process until a neat and effective seal is produced. You can see this effective seal which is produced. This is a functional physiological record of the post-dam. You can also record with the help of the mouth temperature impression waxes. First we have to soften the wax and then apply impression wax on this post-dam area with the help of the brush, and this should be a 2 millimeter thickness of the wax. Reinsert the tray into the patient's mouth and perform the functional movements such as awesome pronunciation, swallowing, flexion, and rotational movement of the head. To become properly molded and record the functional or physiological post-dam. Then we will take it out from the patient's mouth. The denture border should be extended to the end of the wax. What is the purpose of tissue displacing nature of the posterior palatal seals? These are to recess the denture border in the posterior to minimize the end of the denture to the patient's tongue during swallowing and speaking, create a border seal to decrease the risk of dislodgement of the denture upon speaking and mastication, also counter the polymerization shrinkage that occur in processing of denture that pulls the process base away from the cusp along the palate. This is polyether final impression. So polyether final impression materials are also available in medium viscosity materials. You can record the periphery in single step. So here the post-dam is recorded with a green stick, and then you have to apply adhesive on the bottom of the tray, including the fitting surface as well as once the adhesive becomes dry, then you have to add the material all around the border of the tray. Then insert the tray in the patient's mouth and record the periphery in single step. Once you record the periphery, then you have to record a secondary impression. Disinfection of the impression, which is an essential step for preventing cross-infection exposure of the laboratory persons. So this disinfection is to be carried out after rinse the impression with the tap water, and the disinfection can be performed by immersion or spray technique. After regional impression can be disinfected by immersion in a 2% alkaline neutral solution. Elastomer impression materials like on especially hydrophilic material can be disinfected by spray with 2% alkaline neutral solution or iodophore 1:213 dilution stored in plastic bags for 10 minutes. Polyether impression material can be disinfected with chlorine compound 1:10 dilution of commercial bleach for the 10 minutes, and after they rinse with the tap water, taken out the water and poured with the artificial stones. Thank you very much.